Buddy, welcome once again. I have been away for a while, but thank you for joining us today. Look, let's face it, let's be honest with ourselves. As partners and couples prepare for parenthood, and also couples try to raise a family, um, the nature of the vagina is critical. It's critical for the sexual interactions between both couples. It is also critical for the how desire, arousal, orgasm, pain, satisfaction, function is felt in women. And if a woman is having a good experience, if a woman's if the woman's the vagina of the woman's is in a good condition, then it's most likely that sex will be enjoyed. It's also important to know that vagina changes during pregnancy, and of course it does change after pregnancy, and each of these changes can affect how sex is enjoyed. Well, welcome once again to the ninth edition of our series, Church and Sexuality, where we talk about all things that have to do with sex and intimacy and some of the subjects that the church doesn't really go deep into. This is a ninth installation, and we want to dig right in. So, what is the impact of childbirth on female sexuality? And today I'm going to be looking at a study by Psychology, Community, and Health done in 2012. I'm going to be leaning on the results of that study to help us to navigate what these experiences look like. But first of all, I think it's important to understand the hormones that play a role actually in in the status of the vagina as it is. And one of the hormones that we need to understand that is critical to the condition of the vagina is estrogen. Estrogen is very important to the level of lubrication that a woman will experience during pregnancy. So it's important that a woman's estrogen levels are at a good level so that she can be well lubricated. Now, what happens to the vagina post delivery? 9 months of pregnancy, there are a lot of changes that you expect to happen. The vagina stretches after birth, and how much stretching happens depends on the size of the baby, and that's why some women have to undergo something called episiotomy, where there is a slight tear to the vagina to allow for the head of the baby to come out safely without causing extensive damage to the muscle tissue of the vagina. So episiotomy can be done, or if the episiotomy is it's if the pregnancy is not progressing significantly, then perhaps the doctor might want to conduct an emergency cesarean session. So that is one of the things that happens. And sometimes you also have situations where forceps are used, or there can be a vacuum extraction depending on how the baby's head is positioned, or if the baby is aligned with the walls of the cervix in a wrong position. So sometimes there can be some manipulation that the midwife or the delivery team will want to do to see how they can facilitate a normal vaginal delivery. All right, so the next thing that we need to understand is there can be a lot of soreness, discomfort, and bruising, especially after a vaginal delivery. If a woman has had delivery through the vagina, there can be soreness. Come on, you see the size of that head and where it came out from. So the woman will feel sore. If there's an episiotomy, there will be pain, and there would have been some stitches right after to repair the tear that has been medically done. Now that's been necessitated during delivery, and so know that the vaginal walls have been stretched, and so they will need to go. They'll experience some stretch, some pain as well. And some of this pain, especially if a cesarean has been done, if there's a sneezing or a cough, it might if you try it yourself, put your hand on your stomach and then cough, you see that tightening that happens on the lower abdominal area. Okay, so if there's been some suturing that has been done either in the abdominal area or in the vaginal area, a cough or a sneeze can cause some pain. Okay, and also there can also be some burning sensation. There are so many kinds of injuries that can happen to the vagina after delivery, and it takes about 7 to 10 days, for the healing to for the sutures to heal after the episiotomy the stitches are done post episiotomy. Okay, you can also know that there are some levels of vagina dryness. Okay, because after delivery, what happens is the estrogen levels falls. Okay, estrogen levels falls, and when you have low estrogen levels, we'll talk more about this when we look at the impact of aging on lubrication. Okay, so estrogen levels, there are lower levels of estrogen, and this thins out the tissue in the vagina and increases vaginal dryness, okay, and tightness after birth, especially compared to pregnancy levels. Okay, so after the pregnancy, after childbirth, the estrogen levels decline significantly, causing the vagina to thin out and also to become really dry. Okay, and if you're breastfeeding, the mother could feel more dryness, which can also suppress estrogen. Okay, so although this should change when you stop breastfeeding the baby, when you stop breastfeeding, changes. So we continue after the one of the things that we need to know is after birth, pain can be felt during sex. Now, in a few weeks to months after vaginal delivery, especially vaginal delivery, your vagina may be noticeably stretched, and sex can become a little tender and even painful for a while. So it's important that as a husband that you are patient with your spouse, or as a woman you understand why this is happening, so that you can talk to your partner and both of you can understand what is going on. And so sometimes the doctor will ask you to stay away from sexual intercourse for a little bit before you go back into it. So it's important that you do not get intimate immediately for several weeks or months, so that you can heal significantly. Even if it's a vaginal, even if it's a C-section, okay, it can make intercourse painful as well. Okay, there can be also some incontinence. Okay, there's always an urge to pee, or even an inability to hold urine. So before you even realize that you're pressed, you're already leaking. Okay, when you sneeze, when you cough, when you laugh out loud, it could lead to some dripping. So don't be alarmed when you see this, because the nerves and the pelvic muscles that are meant to hold urine and feces in place, they have become weakened during that pregnancy because of all of the hormonal changes that have occurred and the weight of the baby pushing on the pelvic floor. So don't be alarmed. Okay, your doctor should tell you, your gynae should tell you what to do and how to convert in this. There's so many exercises that can be done to help to correct this. There can also be some difficulty in bowel movements. Okay, you can have bowel movements. So I'll just take this time to say, if you haven't subscribed to our channel and you have been educated and you're enjoying it and you like what we're doing here, please subscribe, please like, put on your notification bell so that you can be notified when we upload new videos. And also, if there are questions, please leave a comment or question in the comment section, and I will get right back to you or you can send us an email and we can answer your questions. If it's something you don't want to put in the public sphere, you can send us an email to thisbloomingroom@gmail.com. All right, so let's go on. So what can you do about this? Okay, so perineal massage. In the months or so, when you're preparing, you can conduct some massage. There are also some exercises you can do, but now we're going to go to the main article that I wanted us to look at today. Okay, there was a study conducted, like I said, and this study looked at the impact of it was an exploratory and descriptive quantity study, and it looked at 62 women in the first stage and 52 women in the second stage of pregnancy. And we're going to dive right into this the results section, which is captured in the discussion section. So what are the things that came out? Now they talked about lubrication, and what was said was that there was no difference between the two groups of people. Now this is not in accordance to what was said, but that is how studies are done, because when you do a study, you want to look at what somebody else has done and what your results are telling you, and then compare results to see why. So what about pain? Now it was said that most women reported having had low or moderate pain during the first intercourse. Now we're talking post pregnancy, okay, after the delivery. All right, so after delivery, most women did say that they had some sort of pain, which in medical sciences is called dyspareunia. Okay, dyspareunia, and that we'll just say pain just to make it easier for all of us. So there is some level of pain, and also significant higher sexual satisfaction levels 3 months. So that's what we said, weeks or months after delivery. It's not advisable. A few months, you're not advisable to have sex, but the doctor will guide you on when to go back into it. And after return 3 months later, there was a significant number of participants who said that they had higher levels of satisfaction 3 months after delivery compared to when they were pregnant. Okay, and also that satisfaction was moderate. All right, so it might not go back to pre-pregnancy levels, but it increases after delivery. All right, I'm just going to go back again up here and just a slight look at this, that when compared to based on statistics, we can observe that in the period after childbirth, orgasm. So orgasm is also a very important subject. It was not significantly affected when compared to the same group of women during the gestation phase. Now, what is 6 weeks after delivery? Most women reported that their ability to have orgasms had improved when compared to the period before pregnancy. So what is this saying here? That the difficulty in having orgasms was most evident 3 months following birth. So 3 months following birth, you might not have orgasms, the kind of orgasms that you had before pregnancy and before pregnancy. So gradually it will return to pre-pregnancy levels. However, so you need to take note of this. 6 months after delivery, a significant number of the women that participated were said to have likely reached the orgasms that they had compared with the period prior to pregnancy. So about 6 weeks after, about 3 months after 6 will likely improve. Okay, so this is important. So what I would like to say is, note that there could be some pain and discomfort. There could be some dryness, because remember that there's been some stretching, but some of these things are supposed to have reversed after a while, between 3 to 6 months. There ought to be some significant improvement in orgasm, reduction in pain levels, more lubrication after a period of less lubrication, and also some return to sexual satisfaction. All right, so don't be disheartened. Having a child is part of the process, if that's what you want to do. So take note of these changes so that you're not alarmed by the changes that are going on in your body. Okay, don't be alarmed. So I hope this has been helpful. Have take a rest, talk to your gynae if anything unconventional or out of the ordinary, significantly out of the ordinary has taken place. And I'll talk to you again in my next video. Thank you. Like, subscribe, and share. Have a great day ahead. All right, bye.